Hi everyone, this is Dr. Pasunuti Sumanth, consultant pediatrician. Many parents have been asking about this topic, and here is the video regarding cradle cap. Many babies have these thick yellowish scales on their scalp. You might also notice these scales or redness on their face, in their neck folds, and behind the ears. This oily rash on your baby's scalp is called cradle cap, and it's a type of seborrheic dermatitis that's found on the head. Cradle cap usually starts between 3 weeks and 2 months after the birth, and it is extremely common in babies. In fact, 70% of the 3-month-old babies have this cradle cap. So, my dear parents, understand how common is this condition. So, what does this cradle cap look like? I'm going to show a few examples of how this cradle cap looks on a lighter and darker skin. Anything greasy or oily on this hair is almost always cradle cap, and if you have any doubts, please do confirm with your dermatologist. So, when this cradle cap spread from the hair to the other body surfaces? Yes, this can present in other places like baby's face, armpits, neck crease, and diaper area. And when it's not on the scalp, it is called as seborrheic dermatitis. Cradle cap and seborrheic dermatitis are rarely itchy, so they do not cause any discomfort to the baby. And the most important thing is they don't spread from one person to the other. So, my dear parents, stop worrying. Now we will see what are the causes for this cradle cap. See, there is no single exact reason for this cradle cap. One theory is that it's a reaction to some common yeast organism that everyone has on their skin, and another theory is that the mother's hormones cause the baby's oil glands to overproduce. Cradle cap isn't caused by an allergic reaction or an infection, and it doesn't happen from poor hygiene either. So, how long does this cradle cap last? Cradle cap usually goes away by itself within few weeks or months, and in most cases, it will completely disappear by the end of 1 year. But some children might continue to have this flaky buildup on their scalps for longer durations. Now, we'll see what is the treatment for this cradle cap. Actually, there is no need to treat this cradle cap, but there are few tips to help the scales come off more easily, including these. First thing to do is wash your baby's hair more often. Every other day is helpful for the most babies, and if your baby has another skin condition, ask your pediatrician or dermatologist how often you should bathe them. Whereas to those babies who doesn't have this cradle cap, head bath is needed only once or twice in a week. The next thing to do is loosen the scales while shampooing. You can do this with gentle massage, a soft brush, or a baby comb as shown in this picture. For tough scales which are hard to go, apply a little mineral oil, coconut oil, or a petroleum jelly so that they are loosened. Apply and leave it overnight to loosen the scales, and next wash and massage or brush your baby's scalp as usual so that this will come off. My dear parents, remember this. As a parent, it might be tempting to scratch or pick at the scales, but you should never do this. This will increase the risk of infection. And don't be tense if your baby's hair come off with these scales. It will definitely grow back, and stop panicking. Now we'll see how to prevent this cradle cap from coming back. Once the scales are gone, keep washing your baby's hair frequently with a mild baby shampoo. This will help stop the cradle cap from coming back. Last thing is when to see your pediatrician. If the cradle cap becomes crusted or has secretions or pus-like thing, should definitely meet your pediatrician. And there are other signs where you should also meet your pediatrician, such as a rash in other places beside the scalp, especially if it's severe, and if the rash has pungent smell like thing, and if your baby appears to be in pain or discomfort, if there is oozing fluid or bleeding from the scales, and the affected skin looks swollen. So, if you notice any of these signs, please visit your pediatrician. And to summarize, this is how you should take care of cradle cap at home. If you have any further queries, please do ask us in the comment section, and thanks for watching.